Hi, my name is Luann Lonergan. Can I have your name? Mrs. Smith, good. Can I check your armband and your date of birth? Wonderful. Mrs. Smith, I have your tube feeding here today. I've checked the MAR, the Medication Administration Record, and it looks like you've got a tube feeding due. Yep, okay. So I'm going to set up, for the purposes of this video, a couple of different ways that we're going to give this tube feeding. So I've already checked, and you've got nice bowel sounds, no nausea and vomiting. Are you having any nausea and vomiting? Good. And we're going to go into the gastrostomy tube, which is right here. There is a port here with a balloon holding that in to the stomach, and here's the port that I'm going to use to instill that tube feeding. So first thing I'm going to do is I'm going to get a few of my ways set up, and I would have checked already, allergies, checked the MAR, and I've got the Osmolite was the can that is due. So this is going to be an open system. So I like to shake that real well. I check the expiration date here, and I like to always wipe off the top like you would any can. All right, good. And again, for the purposes of the demonstration, I'm going to use water here, but I would have measured that out, and I've got here 700, and they're asking for 300. So I'm going to go. Just measuring that out. Beautiful. All right, so I've got a bag here, and these bags are good, and the first thing I like to do with any kind of tubing is I roller clamp that all the way down. And this is clean technique, so I've got clean gloves on, and I'm going to pour in then my tube feeding solution. And again, I've checked for any allergies, and this person has been tolerating that very nicely. Good. Okay, then I'm going to clip that there. And I have to prime that tubing. So this is going to be by gravity. Oops. And so I'm going to get the drip chamber. I'm going to press that a couple times. And now I'm going to take the cap off here. And I'm going to really be able to drip that solution until it comes out. I'm going to use the roller clamp now, and I just want to prime out all of that air. I don't want that patient to get the air. There we go. And this is done once a day, so this tubing will be good for 24 hours. There we go. And I'm gonna cover that up and just have that set to go. So that is by gravity. Let's say I was going to use a pump. There's just a little bit different. I would use pump tubing. And most pump tubing has a bellows here that we're going to have to prime it using the bellows, and then we'll have a pump here. This would be if I could give, this is intermittent. I usually give between 200 to 500 cc's QID depending upon what the physician orders, and this many times is run continuously at a smaller rate, at a very slow rate. So this would be a bag that I would again do the same thing. I would measure out what the surgeon or the physician measured of the tube feeding, and I would put that into the bag. There we go. This is clean technique. Okay. All right, same thing that I did before. I press the drip chamber a couple of times just to fill that up. And now I'm going to take off the end here and hold that over the garbage, just on over, and I'm going to press the bellows now. And when I press the bellows, that should go prime the tubing. I've got to do that a few times to get that. There we go, good. So that really gets through the tubing. I just don't want to give any kind of, all right, good. So I'm all set here. My pump is plugged in. So now I'm ready for Mrs. Smith. So the first thing I'd like to do, again, is just check that placement. So I'm going to take a syringe, and what I'm going to do is I'm going to just go on in. I like to clamp off here so I don't have any gastric secretions coming out. And I want to aspirate to see if I get any kind of gastric residual, they call that. So I'm going to pull back. All right. I'm pretending that, again, about 30 cc's came back, and if it's under 100 cc's or 100 mils, I can push that right back in. That's right in the stomach. This is a gastrostomy tube. Very good. If it was over 100 milliliters, I would hold that tube feeding. Now, I want to make sure before I give this that Mrs. Smith has to be at an upright position. So I'm going to put her at least at 60 degrees. So Mrs. Smith, I'm going to pull you up a little bit just to make sure that she is up, and I'd like to keep her up at least 30 to 45 minutes after the tube feeding. Okay. Now I'm going to give this one by bolus. So I'm going to pour in some of the tube feeding I would have measured out, and this one would be by bolus. So I'm going to take out the plunger, and for this one I would be able to hold it right here, and I would be able to give that tube feeding this way by bolus. And again, sometimes people tolerate that like so, and I would give the whole tube feeding like that, and then I would have to have some water flush. So I pretend this is some water flush, and I'd flush that tube feeding with water. Okay, now I'm going to go to the second way we could do this. We've checked for placement. I've checked for residual. Now I'm going to go to the gravity one, and I'm going to come on over here, and I'm going to take the tubing, and the tubing has all been primed, and this is about 12 inches above the insertion site. There we go. And I've primed that so I can take the cover off. And again, I'm going to pinch this tubing here, the gastrostomy tube, open this on up, set her on in, and then I'm going to open up that roller clamp until that drips in, and usually this would take about a half hour, about what it would take for you to eat a meal. So that would be by gravity, and I would just open up that roller clamp and let that drip in. But again, for the purposes of the demonstration, we can't let that water go into the mannequin. So that's by gravity. And if I had someone that had a tube feeding that was ordered via pump, and many times that goes at very small amounts, so maybe 40 or 50 cc's. So I would look to see what the order was, and I'm going to turn this pump on. I've already primed it, so it's full of tube feeding. So I'm going to turn that on, and I'm going to set the rate, and let's say this rate was 40, okay, 40 mils an hour. So I've got it there. I would do the same thing. I've already checked for residual. We had less than 100, so I'm going to be able to pinch the tubing, open it up, plug it on in, and then I would turn this to run. But I'm not going to do that right now so that doesn't go on in. But I would turn that to run, and that would run continuously. And every 4 to 6 hours, I would check for residual. So that would be by pump. Whichever way that I do that, whenever the tube feeding runs in, I always have to have a water flush after it. So many times I will measure out what the physician has ordered as the water flush, and then I will have my water flush here ready to go, so that I would be able to, once the tube feeding's done, I would open up this top, pour in the water flush, and then that water flush would flush out that tube feeding going into the patient then. All right, so Mrs. Smith, do you have any questions? I'm going to keep you sitting up at least an hour after that tube feeding goes in. And again, if there's any trouble with that, if you have any nausea or vomiting, certainly give me a call, and I'll put that bed down and the call light within reach. All right, thank you.